Is physiological role of prostaglandins. This is a topic in M.Sc Final Chemistry, Elective Paper-VII, CH507, Chemistry of Natural Products, Unit-V Prostaglandins. The contents I will discuss today is the introduction part of prostaglandins, a little bit of biosynthetic pathway and how inhibition of synthesis occurs, and lastly, the physiological role of prostaglandins. I am Dr. Magan Prasad, Associate Professor, Department of Chemistry, M.Sc Government PG College, भरतपुर राजस्थान. प्रोस्टाग्लैंडिन्स के बारे में पहले भी पढ़ चुका है, लेकिन यहाँ शॉर्ट में जो है तो प्रोस्टाग्लैंडिन्स पीजी are a group of physiologically active lipid compounds called eicosanoids having diverse hormone-like effects in animals. Prostaglandins have been found in almost every tissue in humans and other animals. सारे टिश्यूज ह्यूमंस और अदर एनिमल्स में पाए जाते हैं, एवरी टिश्यू के अंदर जो है. Prostaglandins were discovered in human semen in 1935 by the Swedish physiologist Ulf von Euler. Little bit of biosynthetic is discussed today. Prostaglandins are synthesized in the cell from the fatty acid arachidonic acid. Arachidonic acid is created from diacylglycerol via phospholipase A2, then brought to either the cyclooxygenase pathway or the lipoxygenase pathway. The cyclooxygenase pathway produces thromboxane, prostacyclin, and prostaglandin D, E, and F. ये आर्किडोनिक एसिड से कैसे बनता है? ये पीजी G2H2 TXAT PGD2 PGE2 PGI2 PGF2 alpha cyclooxygenase 1 cyclooxygenase 2 NSAIDs के थ्रू जो है सो ये PGG2 और पेरोक्सीडेज एंजाइम PGS2 फिर PG सिंथेसिस के द्वारा TXA2 PGD2 PGE2 PGI2 PGF2 2 अल्फा प्रीनियोप्लास्टिक इफेक्ट्स ऑन सेल ग्रोथ. PGE2 जो है पैदा करता है ट्यूमर एसोसिएटेड एंजियोजेनेसिस. PGI2 क्या करता है? प्रिवेंशन ऑफ म्यूरिन लंग कैंसर को प्रिवेंट करता है. इनहिबिशन ऑफ सिंथेसिस, इसके बारे में ज़्यादा डिस्कस नहीं करेंगे, लेकिन क्या है कि फिजियोलॉजी है इसलिए थोड़ा सा. इनहिबिटेड बाय NSAIDs. Glucocorticosteroids inhibit the release of arachidonic acid from membrane lipids. Arachidonic acid COX-1 COX-2 lipoxygenase दो टाइप के पाथवे हैं. COX-2 inhibitors इसको होने नहीं देता है. एस्पिरिन, इबुप्रोफेन, प्रोस्टाग्लैंडिन्स, इन्फ्लेमेशन, पेन, स्वेलिंग. लाइपोक्सिजेनेज अगर नहीं, इसमें 5-LO इनहिबिटर्स काम करता है तो ल्यूकोट्राइन्स के बनने में अवरोध पैदा करता है. सिस-LT इनहिबिटर्स यहाँ होते हैं, ये भी नहीं बनने देते हैं सिस-LT के द्वारा जो है ये. तो ये कुछ इनहिबिटर्स हैं जो अवरोध पैदा करते हैं. इन्फ्लेमेशन, ब्रोंको कंस्ट्रक्शन, एयरवे ऑब्स्ट्रक्शन, सेल इन्फिल्ट्रेशन, इन्फ्लेमेशन, पेन, स्वेलिंग, ये सारे प्रोस्टाग्लैंडिन्स के जो फिजियोलॉजिकल रोल है उसके बारे में कुछ बताया जा रहा है. अब यहाँ पे बेटर वे फिजियोलॉजिकल रोल ऑफ प्रोस्टाग्लैंडिन्स यहाँ देखते हैं। पीजीज पैथोफिजियोलॉजिकल। सीवीएस। सीवीएस क्या है? Chorionic villus sampling. A chorionic villus biopsy is a prenatal test that involves taking a sample of tissue from the placenta to test for chromosomal abnormality and certain other generic problems. इसमें both PGE2 and PGF2 alpha, mostly vasodilators, but PGF2 alpha constricts pulmonary vein and artery. PGI2 uniform vasodilator and potent hypotensive. PGE2, PGG2 and PGS2 biphasic response, actually vasoconstrictor TXA vasoconstrictor heart stimulates PGE2 and PGF2 alpha, direct weak and reflex action, no role in systematic vascular regulation, but PGI2 COX2 generated local vascular tone dilator. PGE2 keeps ductus arteriosus patent, aspirin and indomethacin exudation. PG is generated by COX2 with LTs and other autocoagulant inflammation. कुछ फिजियोलॉजिकल एक्टिविटी है इसकी। यूटेरस के अंदर जो है PGE2 and PGF2 alpha uniformly contracts uterus, pregnant and non-pregnant, higher as the pregnancy progresses. Consistent contraction PGF2 alpha, but PGE2 relaxes, not pregnant, and contracts pregnant uterus. Atom softens uterus. किसी टाइम पे ये यूटेरस को soften भी करता है. Role initiation and progression of labor by PGF2 alpha aspirin delays. Semen in high PGs, movement of female genital tract, transport of sperm and facilitation of fertilization. Semen in high prostaglandins, movement of female genital tract, transport of sperm and facilitation of fertilization. Dysmenorrhea, uncoordinated uterine contraction, ischemia, pain, aspirin effective. कुछ क्या बोलते हैं फार्मास्यूटिकल वर्ड्स हैं, इसको थोड़ा उससे नेट से ले सकते हो, नेट से इंटरनेट पे इसके बारे में। ब्रोंकाइल मसल्स, यहाँ पे भी PGF2 अल्फा, PGD2, TXA2 एंड LTs पोटेंट ब्रोंको कॉन्स्ट्रिक्ट करता है, सिकुड़ाता है। PGE2 greater than PGI2 dilators plus inhibited release of histamine, but no clinical use. Irritation. Role. Asthma. Imbalance between the above. Aspirin induces asthma, diverts arachidonic acid to produce more LTs, LTC4 and LTD4. In allergic asthma, leukotriene. GIT, intestine. PGE2, increased propulsive activity. Colic and watery diarrhea. PGE2 increases water, electrolyte and mucus secretion. PGI2 opposes. Role. Toxin-induced increased fluid movements in secretory diarrhea. Aspirin reduces fluid volume. Colonic polyps and cancer. Reduce colonic cancer and reduce polyp formation. Stomach के अंदर भी जो है PGE2 greater than PGI2 reduces all gastric acid secretions. Also pepsin. Gastrin also reduced, even histamine, gastrin and other induced ones. Mucus, HCO3 secretion increased with increased blood flow. Anti-ulcerogenic role. PGI2 regulation of gastric mucosal blood flow. Natural ulcer protective. NSAID induced ulcers due to loss of protective function. Gastric mucosal feces are produced by COX1. Selective COX2 inhibitors are not ulcerogenic. Kidney के अंदर PGE2 and PGI2 diuretic effect. Renal vasodilatation and inhibit tubular reabsorption. Furosemide like inhibit C1 reabsorption. TXA2, renal vasoconstriction. Role: PGE2 and PGI2 produced by COX-2 in kidney. Intrarenal blood flow regulation and tubular reabsorption. Less. Retain salt and water. Renin release PGE2 and PGI2. CNS. Poor penetration. Injected directly. PGE2. Sedation. Rigidity and behavioral changes. PGI2 fever. PGE2 hypothalamus pyrogen induced fever and malaise. COX-2 involved selective COX-2 inhibitors, antipyretic, neuromodulator, pain perception, sleep and other functions. ANS inhibition as well as augmentation of NA release depends on PG species and tissue. Modulates sympathetic neurotransmission. Peripheral nerves. Sensitive afferent nerve endings to pain inducing chemical and mechanical stimuli. Irritate mucous membrane. Role: analgesic during inflammation. आई के अंदर भी जो है PGF2 अल्फा induces ocular inflammation and lowers IOP, enhances avascular and tubular outflow. Letanoprost. Role: local PGs facilitate aqueous humor drainage. Less. COX-2 in glaucoma. Endocrine. Facilitate release of anterior pituitary hormones GH. Prolactin, ACTH, FSH, LH, also insulin and steroids. Role: terminate early pregnancy in women. Luteolysis. Metabolism. Antipolytic. Insulin-like effect. Mobilize Ca double plus from bone. Platelets. TXA2 greater than PGG2 greater than PGH2. No pro-aggregator. PGI2 and PGD2 anti-aggregator. PGE2 inconsistent effect. Role: TXA2 and PGI2 ये क्या करता है? Mutual antagonist, prevent aggregation of in circulation but induces aggregation during injury. TXA2 produced by COX-1 amplify aggregation. Aspirin low dose hemostasis interference by inhibiting platelet aggregation. COX-1 inhibition at portal circulation. PGI2 not interfered endothelium. Clinical applications of PGs. Abortion में यूज होता है. इंडक्शन ऑगमेंटेशन ऑफ लेबर. सर्विकल प्राइमिंग. postpartum hemorrhage, peptic ulcer, glaucoma, to maintain patency of ductus arteriosus to avoid platelet damage. प्रोस्टाग्लैंडिन्स एनालॉग्स उसी के जैसे जो है प्रोस्टाग्लैंडिन E1 मीजोप्रोस्टल ओरल इंट्रावैगिनल जेमोप्रोस्टल अल्प्रोस्टाडिल जेमोप्रोस्टल अल्प्रोस्टाडिल और आर्थुरल इंट्रा cavernosal route. Prostaglandin I2 epoprostenol 4 prostaglandin F2 alpha latanoprost ophthalmic carboprost IM prostaglandin E2 हाँ हाँ लाइट जला लो. Dinoprostone intravaginal misoprostol prostaglandin E1 sold under the brand name Cytotec. Clinical use: NSAID induced peptic ulcer, therapeutic abortion, induction of labor. It causes repaining and softening and dilatation of cervix. It binds to myometrical cells to cause strong contraction leading to expulsion of product of consumption. Common side effect diarrhea, abdominal pain. Alprostadil, prostaglandin E1. Prostaglandin E1, also known as alprostadil, it is naturally occurring prostaglandin which is used as a medication. Uses in babies with congenital heart defects, it is used by slow injection and to vein to open the ductus arteriosus until surgery can be carried out. By injection into the penis or placement in the urethra, it is used to treat erectile dysfunction. Common side effect when given to babies include decreased breathing, fever, and low blood pressure. When used for erectile dysfunction, side effects may include penile pain, bleeding at the site of injection, and prolonged erection. Priapism, prostaglandin F2 alpha. It's sold under the brand name Gelatin. Uses to treat increased pressure inside the eye. This includes ocular hypertension and open angle glaucoma. It is applied as eye drops to the eyes. Onset of effects is usually within 4 hours and they last for up to a day. Common side effect: blurry vision, redness of the eye, darkness of the iris. Carboprost, prostaglandin PGF2 alpha. Carboprost sold under the trade name Hemabate. Used in postpartum hemorrhage caused by uterine atony not controlled by other methods. Termination of pregnancy in the second trimester. Common side effect: diarrhea, most common, may be sudden in onset, flushing or hot flashes, fever, chills, nausea, vomiting. Side effects: nausea, vomiting, watery diarrhea, uterine cramps, vaginal bleeding, flushing, shivering, tachycardia, fall in BP. Contraindications: bronchial asthma, epilepsy, hypersensitivity to the drug, renal disease, hypertension, etc. ये some of the physiological role of various prostaglandins. इसको थोड़ा इसके जो एब्रिवेटेड फॉर्म्स है उसको जो सो ऑनलाइन नेट पे भी देख के सारे जो सो एक एब्रिवेटेड वर्ड्स है उसका जो सो, क्योंकि ये थोड़ा फार्मास्यूटिकल इसमें वर्ड्स हैं, उसको इजीली अंडरस्टैंड करने के लिए थोड़ा सा हम नेट का भी सहारा लेते हैं और उससे जो है क्लैरिटी हम ज़्यादा आ जाएगी जो है। ठीक है, तो आज का जो टॉपिक हम यहीं पे एंड करते हैं। थैंक यू।